Hello and welcome back to Introduction to Clinical Laboratory Science. My name is Dustin Scott Brewster, and this is going to be the second of a three-part presentation for the first unit of this course. So in the last part of this unit, we talked about the history of clinical laboratory science, the definition of clinical laboratory science, and then we talked about the accreditation of both the facilities, the hospitals where you would do laboratory testing, and credentialing for the people working in healthcare and in the laboratory. Now I want to talk about where you would actually find a clinical laboratory. Where are clinical tests being performed? So the most common place is going to be in a hospital. Every hospital is a little bit different. Some specialize in certain areas, maybe oncology, labor and delivery, or traumas. But generally, most hospitals are going to include a full spectrum of laboratory testing. You can also find clinical labs in clinics. So maybe something a little bit smaller where they're not doing a full spectrum of laboratory tests. Maybe a doctor's office where they do routine tests. And then for something more unique or niche, they may send that out to a reference lab. The Department of Health or the state lab, they tend to get more specialty type testing or tests that include newborn screening. So you could find a clinical lab at the Department of Health. And then reference laboratories, those tend to be bigger laboratories where they're handling a large volume. And generally, with reference laboratories, they're going to handle things that aren't very common. And so a hospital or a clinic may not do those types of tests. A reference lab may be more likely to do those odd or less frequently performed tests. So in the last slide, I talked about several types of clinical laboratories. In this slide, I want to talk about how labs are organized. And since hospital laboratories are the most common type of lab, and that's likely where somebody going through an MLT or MLS program will get their experience, I'm going to stick to how a hospital lab is organized. So hospitals vary in size. Some are huge, some are 20 stories tall, some are quite small and maybe rural communities. But generally, everything that comes to the lab goes through a tube system just because it's too inefficient to draw somebody's blood, put it in a biohazard bag, and walk it to the lab. If I'm 5 floors away, that's too time consuming. A nurse can't afford to go down the elevator, down the stairs, into the lab. So they typically have in each nurse station a tube station where they will collect the blood, they'll put it in a biohazard bag, put it in the tube, kind of like you see at a bank, and then that tube will be sent to the laboratory. And it's just kind of a behind the scenes way of transporting specimens through the lab that provides efficiency. Now, everything comes into the lab, whether it's walked or through the tube station, it goes through specimen processing first. So in specimen processing, they'll scan the sample or enter it in manually to notate that it's been received by the lab. Then whoever's working at the front in specimen processing will process the sample. If it needs to be spun down, they'll spin it down in a centrifuge. If it needs to be rocked, they'll do that too. And then once it's been processed, they'll distribute that sample to the department that needs to perform that test. Now, in general, in a hospital lab that has a full spectrum of laboratory testing, these are likely the departments that you're going to see. You're going to see chemistry and serology. Usually those are together because a lot of those tests are done on the same instrument or at least in close proximity. Hematology, which is the study of the cellular components of your blood. Blood bank, which identifies compatibility between maybe a patient and the donor if they are in need of blood, microbiology, urinalysis, and coagulation. So the first area of the clinical lab is going to be specimen processing or receiving. This is going to be the site where everything comes in, is received, and then processed before it's sent out to the department for testing. So different types of specimens that we can receive in the lab include blood. We receive blood or collect blood through a procedure called phlebotomy. We can receive urine. Urine can be received through just a clean catch or a midstream that's just urinating in a cup and then collecting the midstream portion of that. If a patient has a catheter, you can collect sample from a catheter. Microbiology, there are various types of wound swabs that you can collect. I'm sure everybody's had a throat swab at some point in their past. Microbiology would be responsible for culturing and seeing what grows on that plate. And then if something does grow, maybe identifying what that sample is sensitive to. So after the samples are received through specimen processing, they are then distributed to the appropriate department for testing. So after specimen processing, one of the first departments that may receive samples, probably the most common, is clinical chemistry. So chemistry, the easiest way to explain that isn't like organic chemistry or general chemistry. Clinical chemistry specifically is studying the solutes in a solution. So what are the solutes? So solutes include electrolytes, proteins, hormones, enzymes, maybe glucose, lipids, things like that. The solution is going to be the liquid component of your sample. So in the last slide, I mentioned specimen processing. They would need to receive the blood, they would need to spin that blood down, and that's going to separate the cells from the liquid component. Now, in chemistry, they're going to test that top liquid component for these solutes. Here's some examples that I mentioned here. This is a chemistry analyzer. This is a Beckman Coulter. I think this is the DXC, if I'm not mistaken. This is a pretty common instrument. There's various types of clinical chemistry instruments, but generally you're going to see a big automated instrument doing all of this testing. And as I mentioned in the previous part for this unit, it just helps with efficiency and speed and reduces turnaround time. So this is a pretty typical setup for clinical chemistry. The next department is immunology or serology. You can usually use these names interchangeably, although I think serology is probably more common. Now, this department is usually seen in the chemistry department, or they just mix them together. And the reason is because the instrument we showed on the last slide likely does a lot of these tests. So in serology, what is the idea? What are we doing with serology? Well, we're identifying antigen and antibodies or antigen antibody complexes. So if somebody is infected with a virus or a bacteria, their body is going to release antibodies or make antibodies that can help us identify the presence of that infection. So we can identify if a person has maybe HIV or hepatitis C or hepatitis B or maybe syphilis, and we can see that their body is making some type of immune complex, which would confirm some type of infection. We can also identify if somebody is immune from a virus. So when you get your hepatitis B vaccine, we can identify antibodies to that virus to confirm that that person will have immunity to that virus. So those are the types of tests that you do in immunology or serology. So the next department is hematology. Hematology is the study of the cellular components of your blood. In this department, we're going to measure the number of red blood cells, white blood cells, and platelets. So a common test that you do in hematology is something called a CBC or a complete blood count. It's going to measure each one of these components, and then it's going to identify different indices of these components. So not only how many red blood cells, but how big are the red blood cells? How much hemoglobin is in the red blood cells? For white blood cells, we want to know what types of white blood cells are present. Do we have lymphocytes, neutrophils, monocytes, eosinophils? That can help us identify maybe a person's infected with a bacteria or a virus. And then platelets or thrombocytes that will help us identify a person's ability to form a clot. So hematology is the study of the cellular components of your blood. Blood bank or immunohematology, most people say blood bank, is going to help us identify somebody's blood type. So that's called a type. And then what we want to do is we want to screen that person's blood for less common antibodies. So type and screen are the common tests that you do in blood bank. And then if somebody is in need of blood, we want to do what's called a cross match. So in this image here, we have a picture of some blood and it looks like O negative and then maybe a B negative on the right-hand side, blood. So we want to identify what your blood type is. Do you have any antibodies that could cause a reaction? And then I want to know, is your blood compatible with this donor unit of blood? So type, screen, and cross match. That's what we do in blood bank. Next, we have microbiology. So microbiology, they're going to receive various types of swabs from patients that are suspected of having some type of infection, or maybe blood to see if they have bacteria growing in their blood. That's called bacteremia. So that's microbiology. So we're going to detect pathogenic organisms, and then we want to identify maybe what those organisms are sensitive to. So it's called a culture and sensitivity, or the most common test that we do in micro. There's kind of a breakdown of microbiology because there's different types of organisms that can be pathogenic. So bacteria, that would be done in bacteriology. Viruses would be virology. Infectious yeast, mold, fungi would be mycology, and then infectious parasites would be parasitology. But generally, they all fall under the category of microbiology or pathogenic organisms. In the urinalysis department, as the name implies, that is the study of urine. So in urinalysis, probably one of the most common tests that we do is a routine urinalysis. We'll talk about this in more details later, but we're generally checking the physical, chemical, and microscopic properties of urine, where we can identify several things. So urine is going to be a filtrate of the blood that's filtered through the kidneys. So this allows us to identify the health of the kidneys and the metabolic health of the patient. So say for example, I mentioned this in the first part, if somebody has an increase in glucose in their blood, that's going to spill over into the urine, and that could help identify the presence of diabetes. We could have a urinary tract infection, we could have some type of liver disease. There's various things that we can identify through measuring somebody's urine. So that's a pretty common test. We can identify the presence of bacteria growing if somebody has a urinary tract infection. So there's a lot of good information you can get from urinalysis. Coagulation, that's going to be the ability to form a clot. So now we don't want our bodies to clot all the time, but we don't want our bodies to not be able to clot. So it has to be able to respond appropriately to injury. And that's measured mostly through coagulation. Now I mentioned platelets in hematology. They're going to obviously help form a clot, but there's a lot of proteins that react together to help form a stable clot. And it's in coagulation that we're actually measuring those proteins. Now, coagulation can be much more complicated than that, and we'll certainly go into more detail later, but coagulation generally is measuring somebody's ability to form a clot. Now, I mentioned earlier the need to know the urgency of testing. So, in a hospital where we have high priority patients, a lot of the times, specifically in the emergency room or maybe a, a stat surgery or a priority surgery, those people likely need stat testing. So, that's going to be a high priority urgency where we need to do the test very quickly. So most likely a life-threatening situation in the ICU, the emergency room, maybe emergency surgery, those are going to be stat samples. Routine samples don't have the urgency that stat samples do. Maybe these people are just in the hospital for an extended stay and we're doing routine workup. That's pretty normal. Maybe if you go to your general practitioner, they do routine blood work just to check your health. That's not a high priority. There's nothing life-threatening going on. Pre-op, this is going to be time sensitive. They want to do pre-op samples before somebody goes into surgery. Obviously, if they're going to cut into the patient, they want to know, are you able to clot? Maybe it's a high risk surgery where we'll want to do a type, screen, and cross match, as I mentioned in the previous slide in blood bank. If something goes wrong, I need to have blood products ready so I can transfuse those. So those may be part of a pre-op blood workup. So a little more time sensitive than routine, but not quite so much as stat. And usually these are scheduled surgeries, so we just want to make sure we have it done before the surgery. Post-op, this is done a lot of the times after surgery just to make sure everything went well. If it's maybe a more traumatic surgery and the patient lost a lot of blood, we want to do some hematology check testing to see how many red blood cells or the hemoglobin, we'll call that an H&H, in the patient. So that could be a post-op workup. Now, special categories that may be included in testing include fasting. Now, I mentioned in chemistry earlier, there are a lot of tests that we can do. We can check for glucose, we can check for lipids. What I want to do is I want to make sure that the patient didn't just consume a bunch of glucose. If you just ate a cinnamon roll or a bunch of donuts and then you had your blood drawn, you're likely going to have a very elevated glucose levels, and that could indicate the presence of diabetes mellitus, where you don't have diabetes, you just recently ate something. So it's a lot of times necessary to perform fasting testing on routine blood work for screening for different disorders. So fasting is an 8 to 12 hour period without any caloric substance, usually water. Some doctors say you can have coffee because I think it has very few calories, but generally just water 12 hours before you get your blood drawn. So we get our baseline level. So we don't have a falsely elevated glucose or lipid level. NPO is nothing by mouth. So in addition to fasting, we want to make sure we don't take any medicines. A lot of times medicines can affect our blood work. So if it requires nothing, no medicine, it will list NPO or nothing by mouth. Um, Postprandial. So postprandial is after a meal. So if you have a glucose tolerance test or something to measure the screen for diabetes that may be listed as postprandial or nothing, or after 2 hours after eating. Peak and trough blood work. Peak and trough blood work is done a lot of times when people are on therapeutic drugs or potentially toxic drugs. So we want to make sure that we are maximizing the therapeutic benefit of a drug without giving the patient too much. Now, this isn't necessary for all medicine, but just medicine that could potentially have a toxic effect. So for that reason, we want to measure the highest concentration, which is generally 30 minutes to an hour after a drug is administered. And then we want to measure the lowest concentration, and that would be the trough, and that's usually right before the next dose. So we want to ideally get it in that therapeutic range without giving the patient too much or too little of that drug. That's called peak and trough. So who can order laboratory tests? So for all the departments I just mentioned, chemistry, hematology, blood bank, micro, the person that can order a laboratory test is going to be that person's medical doctor. So it can be an MD or DO. Sometimes it can be a nurse practitioner, but in general, the safe answer is a medical doctor. Those are the people that can order tests to identify the health of that patient. Now, again, the reason for this is because medical decisions are being based on this laboratory data. So we want to make sure that the people that are ordering are also the ones making those medical decisions. So who can order a laboratory test? The answer is a medical doctor.